They are being trained on the various instruments so that they learn. Next slide. We inaugurated de-addiction clinic and psychiatry because we did not have this. We also want ENT, dermatology and departments to be created here because at some point of time we think one of the network is 1,000 crore Genome India project. I feel humbled that I had initiated this when I was in AIIMS New Delhi. Now India has its own genome base. So this was inaugurated by Prime Minister, and SKIMS was one of the leading institutes at that. Next. So we have, this has come in Nature Genetics paper. This is one of the top-notch journals in the world. And we also had, I was also as a chief coordinator, one of the task force by ICMR, that is 37 crore rupees task force. That is PCOS. That paper came in Journal of American Medical Association, which is again one of the top 3 journals of the world. Then we also have one more paper in Lancet. So this year we had multiple good papers that gives fillip to the SKIMS and comes on global map. We have other research projects which we have obtained in this period. I have under my mentorship also I have some 15.5 crore project which came last month. We have also fostered collaborations. I have one Professor Muzaffar who is in charge of collaboration. We had collaboration with Ayush, we had collaboration with Indian Oil, we have collaboration with other NBCC as well as other scientific bodies. We want to develop some infrastructure in MOU with NBCC. Indian Oil has given us 2 shelter sheds, and JK Bank has given us infrastructure for machinery, some equipment. We have done some special drivers, of course, that is part of our duty. So these to increase the hygiene and security level at institution. That is part of it, fire drills and other things, but they were not there now. Some parks also we are trying to build that so that the ambience at institution improves. We have also started these public consultation programs, public darbars, and we have also started for students and faculty some matches and some cultural activities so that the milieu and the vibrancy at the institution is brought at par like other institutions. We have had recently the Sampurna Kendra inaugurated here. We also have had annual day. Many facilities were inaugurated by the Honorable CM and his team at the SKIMS. We had also celebrated these as part of routine activities. We had International Nurses Day for employees welfare. Employees were disgruntled when I joined. A lot of them were actually for a long time they had not been promoted. With your support, sir, we were able to notify rules, and we have now a promotion of almost 1,000 employees done. And those positions which will be created, I request your good self to give a direction to JKPC so that they do on. Although employees have expressed gratitude, I express gratitude to your administration that those vacancies are filled on fast-track basis so that all the high-end services which are aimed at are realized actually. So we also had other programs for community. SKIMS understands its responsibility towards the community. Our faculty and staff are going for outreach programs, and we also take substance abuse, tobacco, other social evils. We want to be shoulder to shoulder with the administration to improve these things. For example, brain injury, stroke, road traffic accidents, tobacco, and drug abuse. We want to help in that. We also did some programs on women empowerment here because we did have some complaints about those when I joined. So we have started taking those steps both at SKIMS College and SKIMS here. And so employees welfare, we are doing many things, and we want to start some sort of a welfare for them, like CGHS scheme or something for retired employees. We can want to create a corpus so that these employees, if they get sick or they have problems, they are supported. For future, sir, I will give a future vision, detailed vision in my review, which we are going to take soon. But briefly, I will say we want this institution to be now a medical university, not only for our own 1,000 seats which we have. I think we can cater even to other colleges also. If you feel fit, SKIMS can.
Distinguished faculty members, heads of departments, senior doctors, chief engineer, and all those who are present here in this room. This presentation was really an eye-opening one, the kind of work which has been done, and the best part is that work is being done according to some roadmap, a vision that we want to achieve in 3 years, 4 years, or 5 years. As we all know that the faculty of SKIMS and the institute itself has always had a very high reputation, not only in Kashmir, but all across India. It is rated as one of the premier medical institutes after AIIMS, and it can be very easily compared with PGI, with Chipman Pondicherry, and many other top-notch institutes which are of equal stature. And I am sure that with the kind of dedication and hard work that the faculty of SKIMS is capable of, this institute will only grow further. And I'm sure that we will make significant, rapid progress in the years to come. 3 or 4 things I would like to say. That our focus should be on making the life of the patients easier. The patients come for treatment. But this is not as something which is peculiar to SKIMS only. This is peculiar to all hospitals, particularly government hospitals. The workload is very high. Waiting time is high. Queues are long. It takes time. And the patient gets frustrated and tired. So how can we reduce the anxiety? How can we reduce the difficult condition, stress for the patients? Certain suggestions have been given by Director SKIMS in his presentation. I hope we need to take them further and develop a system where the patient doesn't have to move from one bed to another bed or one counter to another counter to get his reports, to get an appointment. So all these things can be digitized also. Recently the government, I'm sure this system of online appointments is already there. If you can use that app and request all the faculty members also to download it and use it, I'm sure you can have a system of online appointments. You don't need to create another system. But there are very good initiatives being suggested by Director SKIMS, that emergency smart labs and so many other facilities which patients need. And in case you have a better idea about how we can structure our referrals, how we can use technology to reduce the pain of the patients, I would be willing to support you to the maximum extent possible, and I would like to even take that forward to other medical colleges. Another thing that we have to focus is on the quality of care for the patients. Patients come here for quality care. If it is a small disease, they can go to something which can be treated, which is treatable, for which remedies are available. They go to the nearest dispensary or to the nearest sub-district hospital or district hospital. And there is a network of medical colleges in many other districts. So they get some services there. But patients come to SKIMS for high-end quality services. So that quality should not be compromised.